Hey guys, welcome back to another episode of Doctors Go Live. Today we are talking about coping with eczema because September is World Atopic Eczema Day. Now, let us know if you're tuning in right now, where you're tuning in from, and share with us what would you guys love to know about today's episode, Coping with Eczema. Okay, and if you share this video out, I've got some very good news for you. We've got a special treat for you. You get to take part in our Doctors Go Live quiz happening right after the Q&A today, where you stand a chance to win a set of Aveeno body wash and moisturizing lotion. Okay, all this happening right here on Doctors Go Live with me, Nina, and today's special guest, Dr. Shwu Hoon. Okay, now today, because September is World Atopic Eczema Day, we're going to be talking about coping with eczema. Let's take a look at this video first, okay?
Dr. Shwu Hoon, Consultant Dermatologist from Columbia Asia Puchong Hospital. Do you suffer from dry, itchy skin? Do you have sleepless nights due to intractable itchiness? If yes, you may be having eczema. Don't worry, in conjunction with the recent World Atopic Eczema Day, I'm here to share with you on the information on eczema and most importantly, on the do's and don'ts and useful tips in managing eczema to achieve a better quality of life. Welcome to tune in to Doctors Go Live on this Friday, 24th September, 12 p.m. See you!
All right, welcome back. So how do eczema patients go about their daily lives with such a chronic disease? In fact, what is atopic eczema? What are the causes, symptoms, treatments, and who is at risk? What are the do's and don'ts of eczema patients and tips for caregivers? All this happening right now. So if you know someone who suffers from eczema, or if you think this is such an important topic and it's going to make a difference to somebody out there, then please do share this video out on your social media, tag your friends, follow us on all social media. And this episode is definitely going to make a difference to somebody out there. Okay, so let's get straight into this. Now, if you are an eczema sufferer, you know what it's like to have dry skin, to have skin so dry, in fact, that it cracks into thin, fine, and literally bloody lines. Now, that's not even factoring the excruciating pain that comes with it. Okay, so in conjunction with the recent World Atopic Eczema Day on September 14th, we've got you consultant dermatologist from Columbia Asia Hospital Puchong, Dr. Shwu Hoon, so we can dive deep into this. Also, right at the end of the show, you want to enter our Doctors Go Live quiz and stand a chance to win a set of Aveeno body wash and moisturizing lotion for dry skin. So please pay close attention, okay? Now, if you have any questions as well, feel free to ask us in the chat and we will address them right at the end of the session, okay? So, Dr. T, welcome to the show.
Yeah, thank you, Miss Nina. Yeah.
Thank you.
Hello.
Hi. All right. So if you're joining us, please say hello, right? Okay. Now, Dr. T, let's get straight into the basics. First things first, Dr. T, can you share with us a little bit about yourself and what is it that you do?
Okay. I'm a dermatologist. Okay. I started off as a medical specialist. About 10 years experience, and then I subspecialized in dermatology, the field that I'm interested in, and subsequently graduated from UKM, Malaysia. Yeah, initially.
Fantastic. Yeah, you were saying initially?
Initially, I was serving in the hospital KL, and then followed by Serdang Hospital, and subsequently I joined Puchong. Yeah.
Right. Okay. What got you interested in dermatology?
Because dermatology, many people think is a very minor and trivial field, but however, dermatological conditions can have a very great impact on our patient's life, especially if you imagine the patient having severe itchiness on the skin, then they can have sleepless nights, and all this is also causing a lot of trouble to the patient and really affect their quality of life. Huh?
Wow.
Yeah.
Okay. So it seems
That's
like
why,
it's
yeah.
trivial, but it's actually can really impact the life. Yeah. So that's what got you
Yes.
into it. Okay.
Yes.
Just want to say hello to Shakila Azwin. Hey, and Elise
Hey.
Chow. Shakila saying hi, Doc. Okay. So let's get straight into this then. Let's take a look. Let's take a look at the slides then. So first things first, what is eczema? Or rather, I think we need to understand the skin. Doc, can you share with us?
So first and foremost, before we start, let me explain a little bit on our skin structure, so that we can know about the functions and how our skin works. So actually, our skin, maybe many people don't know, but it's the largest organ in our body, and it consists of 3 layers. The outermost layer is what we call epidermis. Okay, then followed by the dermis, and inside we have a fat layer we call subcutaneous fat. Okay, so the skin plays a very important role and provides a lot of important functions. Okay, one of the most important function is the skin is acting as a barrier, as you can see, from the entry of all the microorganisms and all the harmful substances. For example, chemicals, irritations, to enter into our body and subsequently causing a lot of problem. Just imagine if the skin is having some defects, so it increases the risk of all the cracking skin, all the dry skin, right? So all the outsiders, microorganisms, the bacteria, the virus can enter into our skin easily. So it will result in all the infections, inflammation, and a lot of problems, right? So other functions of the skin includes it will maintain our body temperature, because if our skin all are inflamed, for example, as you can see, in a very severe skin condition, the patient can suffer from severe coldness. If you go to the hot area, they feel very, very hot because the skin function is impaired. So those are the other important function of the skin. Next, the skin also allows us to have feel sensation, because underneath the skin there are a lot of nerve receptors. Nerve meaning the saraf. Yeah, it will send the signals to our brain and inform us about the sensation. So it allows us to have a feeling of pain, and pressure, the heat and the cold weather. So that's other important function of our skin. Yeah.
Got it. So what is eczema then? Now that we understand the skin, what is eczema then?
Okay, eczema meaning it is actually non-specific. It's a very broad term. Okay, the term is to describe skin conditions which is inflamed. Okay, inflamed. Inflames is like
That's all I can explain.
actively inflamed. Okay, so actually the word eczema come from Greek word. In Greek, it's to boil, so that's why the inflammation is due to the boiling. Yeah, so it describes a group of inflammatory skin conditions.
I
Mainly
think that's
due,
the next slide, right?
yeah,
That could be the
mainly
next
due to
slide,
the,
right?
yes.
Mhm.
Mainly due to the changes in the outermost layer of the skin. As I mentioned just now, the outermost is the epidermis, right? So there's really a lot of things going on in the outermost skin layer. And all this inflammation, all this radang, very active inflammation will cause our skin to have a lot of changes. So the patient can suffer from the most important symptoms are itchiness.
Okay.
Dry skin, itchiness. And then because of the inflammation, the patient have very reddish, inflamed skin. So you have rashes, and not only rashes, sometimes some other lesions, like skin eruptions and things like that. So the skin becomes sensitive.
Right.
Yeah.
Okay. And is it when you say it's active, that means what? It happens all the time or just like for a while and then stops?
Okay, so actually, the eczema can present with different ways in the different stages. Okay, when we say active, meaning the skin is acute. Okay, acute meaning the inflammation is very active, and then after a while, the eczema will become subacute, go into subacute phase, or we call chronic phase. That is a long-term eczema, which will present differently. Yes.
Oh, wow. Okay. I just want to say hello to a couple of people. There's a couple of people. Gwen Yap saying, "Hi, Dr. T, intern by Zura.
Hi.
Are you my intern by Zura? Just checking." Priya is saying she's ready to share to the public. Well done. Good afternoon, and dietitian
Thank you,
Shansina.
thank you.
And Yan Cheng Chiao is saying Dr. T is very good. She solved my skin problem. Wow. So this is why happy patient tuning in. Okay, cool. In fact, if you're tuning in right now, can you share with us if you guys have eczema or you're here to learn more about eczema? Let us know in the comment section. Yeah. So doc, next question. How is it different from psoriasis? Because I was doing some research and a lot of people seem to mistaken. Is there a difference between the two?
Yeah, there are actually some similarities, but there are also a lot of difference. Okay, from the presentation, the skin appearance, usually scaly. Psoriasis is more scaly, more flaky, and thicker skin lesions. Huh? And so is eczema usually only affect the surface layer, but in psoriasis, the lesions are thicker, very thick lesions, like you are having a plug, what we call a plug on the skin. So it's more scaly, more rough, or more flaky. Usually it's like that, yeah, compared to eczema. And usually psoriasis is less itchy compared to eczema. Patients with psoriasis may not have itchiness even on the skin lesions. And other important difference is psoriasis not only affect the skin, it can affect the scalp and even the internal organ. And it will cause nail changes. And yeah, so sometimes if the patient come with me, they come with a scalp lesion as well, or not only the skin surface. Most likely is a psoriasis rather than the eczema, right?
Eczema, right? Okay.
Then the
So
other
there are differences, lah.
important differences are psoriasis are always, not always, can be associated with very severe complications, which are the joint problems, and also increases the risk of other medical diseases, for example, diabetes, high blood pressure, obesity, high cholesterol. So there are more other associated important complications that need to be looked into. Yeah.
Wow. Okay, and eczema is just on the skin, on the surface.
Yes.
Okay, got it.
Affect the skin, but the psoriasis is a more complex disease, which not only affects the skin, but also the nail, the scalp, and even internal organs, and might lead to the medical complications.
Okay, got it. Now, for those who don't have eczema, can you maybe share with us how bad is this condition? What is it like living with it?
So eczema, as I mentioned just now, it can present in different ways. Okay, so the first thing is the severe itch. Okay, that's the main trouble for a lot of patients. Imagine if it's so itchy that you keep on scratching. Not only the skin become worse due to the repeated scratches, but it also affects your sleeps and your work performance, everything. So those severe, it can be a very severe and major problem for patients. Not only affect the patients, but also the parents. If the child keep on scratching, the parents also cannot sleep well. Okay, so that's a main problem. Severe itch, which will cause impact in quality of life and patient's mental distraction as well. Then other eczema also increases the risk of getting infection. As you can see, when it happened during the acute eczema, the skin can be painful, it's not only itchy, can be painful, inflamed, reddish with weepy discharge. So this increases the risk of complications. The infection might get worse, and the patient can have cellulitis, things like that. Yeah, and But however, when when the eczema becomes long-standing, the patient can have very, very dry skin, and the skin color can change. They can have a dark skin and very thickened skin. Okay,
Mhm.
one
Like this one lah, the chronic one, is it?
yes, the chronic one you
Mhm.
see, the color is darkened.
Dark early.
Yeah. So why it become thickened? Because it's due to the repeated scratching, due to the severe
Right.
repeated
So
scratch.
it starts
Mm-hmm.
with being acute, and then it
Mm-hmm.
goes to subacute, and then it goes
Mm-hmm.
to chronic. When once it
Mm-hmm.
goes to chronic, does it
Mm-hmm.
can it ever go back to normal if we do the treatment and stuff like that? Sorry, I'm very shallow. I'm looking at the beauty part of it, huh? So I'm sure there are people wondering as well.
Okay, so it takes time. Yeah. Huh?
Okay.
Why the skin become so scarred and so dark in color is because if there is any inflammation on our skin surface, for example, due to eczema, due to the minor cuts or any trivial injury to our skin, so all this inflammation will cause the pigments beneath our skin. Pigments, the function of pigment is to give our skin the color, right? So all the inflammation will disrupt the pigments, and therefore, once the inflammation all resolve, the skin usually, because of the pigments are being affected, so the skin turn into different color. Usually, patient will have a darker skin, but in a minority of cases, the skin may become a bit lighter. But most of the patient have a darker skin, and it takes time to improve, fade gradually. So
Okay. But at
when
least can, right?
prevention, prevention is the best. Yeah,
Oh,
once it
prevention
happens,
is the best.
it's
Okay.
really take time. Yeah? It can
Mm-hmm.
be unsightly, and causing problem to the patients.
Okay, so basically, if you kind of see a lot of scratches, you better go and see Dr. T before it becomes chronic, lah, huh? Right? Okay, Doc, I don't know if this question is even relevant. How do you know if you have it, or if does it? Yeah, how do you know if you have it, or you think
Oh,
it's just a
okay.
rash? Is that even a valid question? I don't know. Can you share with us?
Okay, that is a very, very general question. So if you because later on I will talk into the different types of eczema.
Uh huh.
So it's basically if
Actually,
generally for eczema, is a, as I mentioned just now, is a description that the skin is dry, itchy, and inflamed. So that's
okay.
eczema. So usually how doctor diagnose it is basically by checking on your history, and looking on your skin surface, and specific investigation will based on different types of eczema. Yeah. Okay.
Ah, okay, okay, okay. Got
It's
it. Okay.
yeah.
So before I go to the next question, I want to acknowledge everybody who's asking questions here. T. Chin Han, Dang Sok Yi, Alicia, Intan Baizura, it is the Intan I know. So we're gonna answer your questions later. So make sure you stay tuned, yeah. So what are the different types of eczema, and is it
Mm.
contagious? Let's go into it so we can really look into, if maybe you guys have this. Yeah.
Okay. So a lot of people think that eczema is something very specific, but actually it's not true. Okay.
Mm.
A lot of different types of eczema. Mainly, we can broadly classify it into the different causes. Okay. One is that the eczema arise from within our body, in which we call endogenous eczema. The other broad group is exogenous, which is it's arise due to some external triggering factors. Okay, so
Mm.
endogenous is mainly due to our body immune system. This disruption, dysregulation. Okay, not to say our body immune system is lowered, but there's some abnormal body system, immune system compared to it differs from one individual to another individual. So that increases the risk of the patient to get a certain type of endogenous eczema. The commonest type of endogenous eczema is the atopic eczema, in which
Mm.
Mainly when people mention about eczema, they actually point more towards the atopic eczema because this is a commonest type. Okay, this type of eczema usually can present since childhood, but also can present during adulthood, and is family history related. It tends to run in the family,
Mhm.
and yeah. Then
I
other
think
type of
there's another slide on this, right? Can we see the next slide?
yeah, I
On,
mean the courses in which I will elaborate
okay.
later.
Okay.
Uh,
So
because
the
all these eczema, the causes are different, right? As you can see
okay.
questions, what are the causes of the eczema? How do doctor tell you? It will also
Mhm.
depend on the type of the eczema, right? Because the
Mm.
different station, different phases of the eczema, right?
Okay, then
So,
maybe the right question I should ask you is rather than how do you know if you have it, but when should you come and see the doctor
mm,
before it becomes like really, really bad? I mean, some people they just
okay.
won't go to the doctor. So when is it time to go and see you?
Yeah, if you experience severe itch, severe pain, severe inflamed skin, then if you are not sure why is it happen, you never have it before, then I think you should make it clear. You should
Mhm.
seek. You
Mhm.
can go and consult doctors.
Mhm.
The primary care physicians are out there to help. And even specialists, pediatricians, no problem.
Okay,
So
got it.
need to seek treatment early because the more severe it is, the more difficult to treat. Yeah, and then the more
Mhm.
patients you tend to have, and
Mhm.
yeah, it's more challenging to treat. Yeah,
Okay,
so
so better be safe than sorry. Just go and see the doctor. Got it.
yes.
Can we check out the next slide, which is yeah, atopic eczema. Do you
So,
have yeah?
as I mentioned just now, I'm going to focus more on atopic eczema for today because I don't
Mhm.
think enough time to go through all types of eczema. Since this
Okay,
is a
got it.
common type of eczema, okay? So,
Mhm.
this eczema tends to run in the family if the parents are affected. Okay, so if one parent is affected, the risk is about 2 or 3 times increase for the patient to get it. But however, if both parents are affected, it can go up to about 4 to 6 fold increase in the risk. So it's related to the genetic. Okay. So and atopic meaning it is a term to describe allergic conditions. Okay, in
Mhm.
which comprises components of asthma, atopic eczema, and also hay fever, in which we call allergic rhinitis. Okay,
Mhm.
what is in this group of patients, they have increased tendency of allergy in within their body. Okay, so then they are at risk of getting asthma, allergic rhinitis, and eczema.
I
Okay,
see. Okay.
they have asthma or allergic rhinitis. When the adult patient present to you, maybe they also have asthma or allergic rhinitis. Sometimes only during the childhood, and then when they say, oh, when they grow older, they actually outgrow their asthma. They outgrow their allergic rhinitis. They might have
Mhm.
a certain eczema, things like that.
Okay, got
So,
it. Okay, let's take a look at the next few slides. What are the causes and symptoms for eczema? I think that's also a question that some of you are
okay.
asking.
So,
Yeah. Mhm.
to be more specific, these are the causes of atopic eczema. Yeah. So, I think
Mhm.
the title is causes of atopic eczema because today we are focusing on it. At present, the disease is the exact cause is still unknown. Okay.
Wow. Okay.
Complex disease. But however, we do know that it's genetic plays a very big role in this condition.
Mhm.
So we do know that there are certain genes in our body which are affected that cause the trouble on the skin, that which cause the defect on the skin. These genes are important in maintaining our skin to be healthy. So due to some genetic changes in these genes, so our skin function as a barrier is being impaired. The skin has increased to the entry of the substances, increased tendencies of entering of the microorganism to cause a lot of issues later. Yeah. So genetic factors, environmental factors plays a very huge role in the atopic eczema. What happened is because of the skin barrier in patient with atopic eczema is already being affected, right? So the skin is more sensitive. So they are actually, if they exposed to a lot of other environmental factors, for example, the pollutions due to the air pollutions, and then if they are exposed to substances, chemicals, irritations, all these, of course, will irritate our skin, and especially so in the patients with atopic eczema. We've already very to start with a very sensitive skin from the beginning, right? And that smoking, cigarette smokings, and other exposures, some people might be have some increased sensitivity to pets, pets with fur and things like that. And some also they can be at risk of allergy to the topical. Topical meaning things that you use on your skin, including cosmetic products, perfumes, deodorants, all these things. Okay.
What about food? Does food play an important factor as well?
Okay, so in atopic eczema, a lot of people actually has a misconception. Food allergy is the major cause in atopic eczema, but actually food is not the major cause. More of the genetic, environmental factors, immune factors, infections. Food may affect atopic eczema, or maybe triggering factors to worsen it. But it plays a more important role in those with very severe eczema, especially started since a very young age. Okay, so it has been estimated about 30% of the patient with very severe eczema, less than in the age about less than 5 years old. And food allergy is even more uncommon in adulthood. Okay.
Okay, got it. So I have another question. Is it contagious? Because it's written there. It's not, but there's this belief that it's contagious. So what is it?
For atopic eczema, it's not contagious.
Okay.
You cannot get the eczema from the direct contact with somebody else. It's not contagious. We shouldn't like avoiding them.
Okay. Because there's
unless the eczema is due to infection. Yeah. So then
okay.
contagious because of the
Then it's contagious.
infections. Yes.
Okay,
But generally atopic eczema is not contagious. You can if the atopic eczema, you are a good friend with this patient, you will not get it, the atopic eczema. It's like that.
Okay, unless it's an infection. All right, can we take a look at the next slide, please? Okay. Would you like to share?
Yeah, actually, this one, I think just now also we have talked about it, right? So eczema causes a very dry, very itchy, very inflamed skin. Okay, these are the most important signs and symptoms is the dry, itchy, red, inflamed skin. So I have to emphasize on this. It can present in different ways according to the severity, according to the staging of the condition, and according to patient's age, especially in eczema. Yeah, the types of skin being affected differs according to the age presentation, as I will mention later. Yeah.
Got it. Next slide.
So
These are some common sites.
for infants, usually the sites that are being affected is the scalp and the cheek area and outside surface of the hands and the legs. Usually on the outer surface, we call extensor surface. And usually the diaper area is not affected. Yeah, if the
Okay.
area affected, it might signify other type of eczema.
Okay. Next.
When we go into the childhood up to the adolescence, usually the areas which are commonly affected are the skin folds area or the what we call skin creases. For example, you see that these are the skin folds on our upper limbs, and behind the legs is the skin fold, meaning you see behind the legs, right? So these are common in the patient in the children and the adulthood, okay, rather than the outer surface of the babies just now, right?
Okay, got
And
it.
yeah,
Next slide.
in adult, sometimes it can be localized area only. It will be like more localized already, and the skin may be chronic already. Just now, as I mentioned just now, right? Dry,
Mm,
chicken. If you cannot resist the temptation of scratch, so the skin can be very chronic, the dry, scaly, and chicken, or even hardened.
Okay, next slide. Okay, so what are some triggering factors or how for eczema? Do certain things like set it off?
As I already mentioned just now, so many times, patients with atopic eczema, their skin barrier is being impaired due to all the factorials, right? So their skin are very fragile to a lot of irritation. For example, due to the detergents, chemicals, and cosmetic product. Just now I mentioned.
Mm-hmm.
Fumes, deodorants, or even like a dusty environment, sands. So patients like construction workers or laborer, if they have eczema, of course, if they are exposed to a lot of pollutions, the sands, the dirty surfaces, the dust, then it increases the risk of the eczema to get worse. Okay, and stress. Okay, stress is a very major triggering factor. Stress meaning is two factors. One is emotional stress, which means the mental stress. The other
Mm-hmm.
stress is physical stress, meaning the stress to your body. Okay, so and emotional stress can worsen the eczema, but however, physical stress, for example, if the patient is sick recently due to some infections, due to some surgery, patient has some medical problem, have to go through surgery, have some infection or COVID, things like that. So all this is considered a physical stress to our body. Okay, so our body immune system will be affected, and then the patient's eczema can get worse. Other environmental factors are extreme temperature, for example, too cold, too hot, too dry skin, and the humidity wise. So, for example, if the patient is always long hours in the air conditioned environment, the skin can become very dry. And excessive sun exposure, and if suddenly from a very cold environment go to a very hot environment, all this extreme temperature also cause the eczema to flare. And another thing is sweating. Sweats act as a physical irritant to the skin. Then it might cause it to get worse. But however, I'm not saying that you have to avoid exercise.
Exercising.
Exercise is a very important in improving the patient's immune system. Yeah, a lot of patients do find that their eczema actually improve if they exercise regularly. But
Okay.
be careful if you sweat easily. Yeah, make sure it's clean and hygienic lah. Okay.
Okay, so there's ways to manage it. Speaking of
Mm.
ways to manage it, let's take a look at the
Mm.
next slide. For those who have eczema or who are taking care of people with eczema, especially their children or parents, right? Is there a treatment for eczema, a cure, or do we have to live with it? Can we take a look at
Okay.
the next slide? Oh, I think this is it. Yeah.
This is actually more of a diagnosis for the
Mhm.
treatment. Maybe we need to go to the next slide, which is the
Okay.
treatment
So
part.
I guess first things first, we need to see a doctor to get diagnosed because there's so many reasons that we could get eczema, right? To identify the cause, right?
Mm. Yes, yes. Diagnosis. Okay, so the uh, diagnosis of atopic eczema is mainly what we call clinical. Clinical meaning is there's no specific test for doctor to tell you you have atopic eczema. Usually, it is diagnosed based on the medical history. Okay, from what your story that you inform to the doctor, and then followed by what we call physical examination, meaning the doctor, the healthcare will look at the appearance of your skin and then examine. So this is what we call clinical. So what are the factors that strongly points toward atopic eczema? So family history. So
Mm-hmm.
if the patient herself had previous history of atopy, just now I mentioned what is atopy already, right? The
Mm-hmm.
patient had history of asthma before, patient had history of allergic rhinitis before, or the in the family, the parents or the what we call the first degree relative, which are the siblings. If any one of that having those atopic condition, the risk of the patient to get it is higher lah. Then the
Mm-hmm.
other factors which suggest atopic eczema is, of course, the severe itch, the severe dry skin, and the onset usually started since young age.
Okay.
But nevertheless, some of them start to manifest only during the adulthood lah. Okay,
Okay.
and other factors which is important to take into consideration is usually atopic eczema will get worse if they are exposed to all the triggering factors lah. For example, the hot weather, the pets, the irritation due to the chemicals or substances. So the eczema tend to get worse. So these are the important points. Doctor will consider, then doctor will tell you you have atopic eczema, things like that. Yeah.
Okay. Let's take a look at some of the treatments, which is the next slide. Yeah.
Okay, back to just now that question, right? Can it be cured?
Mm.
Okay, at present, there's no complete 100% complete cure for atopic eczema. But of course, there are many different ways that we can do to improve it with the appropriate treatment. Okay, so actually, the treatment we can divide into different groups. One is topical. Topical meaning things that we apply on our skin surface. Topical is the mainstay of treatment in eczema. Okay, with
Mm-hmm.
the the least side effects. Okay, then for more severe eczema, of course, there are some certain other treatment modalities, including phototherapy. Phototherapy is a type of therapy we call light therapy. Light, okay.
Mm.
They use the ultraviolet light to shine on the skin area. Okay. Then for very, very severe eczema, not responding with topical therapy, not responding to the light therapy, there are some strong medication we call to take consumed by mouth. We call the oral medication. But
Mm-hmm.
this medication might be associated with side effects because they tend to dampen the patient's body immune systems. So when if the patient is on at all started on oral medication, they need to be on regular monitoring under the appropriate doctor's follow up. Then
Right. Okay. Can we
to
take a
do
look at the
the
next slide as well? Okay, so this one?
So the most important treatment in the atopic eczema is moisturizer, moisturizer, moisturizer. So I have to say it 3 times, yeah. So topical moisturizer is the mainstay or the cornerstone of treatment in the atopic eczema. Okay.
Mm-hmm.
Regular application according to the severity of the skin condition. The drier the skin is, the more regularly you need to apply. Okay, but at least twice per day. Okay, but for more severe skin, you can apply it diligently. Sometimes even during the very severe cases, 1 or 2 hourly application of moisturizer is needed. Okay, the most effective time is after bath. So after bath, when the skin is a bit moist, then immediately apply the moisturizer on the entire surface. That's the best time for the absorption. And moisturizer are available in different forms. Broadly, we can say it's ointment, and then followed by the cream, and then the lotion. Okay, they differs in terms of the degree of greasiness or oiliness. Okay, lotion contain more water compared to the cream, compared to the ointment. So if the skin is minimally dry, so lotion may be helpful. But however, if the skin is really, really dry, it can get absorbed very fast, and then
Mm.
cream and ointment will be more helpful for very, very dry skin. But a lot of people do not like ointment, like for example, the Vaseline, because of the greasy sensation. They don't like
Yeah.
to, because it's very oily. But however, if the skin is too dry, there's no choice. The ointment will be more effective compared to the cream or
Wow.
lotion. Mm.
Okay.
Um, okay.
Can we look at the next slide? Okay, these
Uh,
are.
Other treatment modalities is the sorry, this is the topic should be oral.
Oh, this
Topic
should be.
topical. Sorry,
Uh,
it's sorry about that. So next, other than the moisturizer, now we have other type of topical to treat the skin problem. Okay,
mhm,
topical steroids, or what we
mhm.
call corticosteroids. I know a lot of people have a steroid phobia. Once we mention about steroid cream, steroid topical, they are so concerned and worried about all the side effects that have Google or from the internet and all that, you know. But
Mhm.
however, topical steroid is very effective and safe if used appropriately. Okay, so appropriately meaning actually the topical steroid come in different strength. We call potency. Okay,
Okay.
the appropriate strength of the topical steroid, and the correct site of the area being applied, and the correct duration. Okay, why is it so? Because for example, for the area on our skin or the eyelid area, like our
Mhm.
private area, armpit area, all those area, lips area. So the skin is a bit thinner on that area. So usually the treating doctor will choose the very mild steroid to apply on those
Mm. Okay.
as compared to the skin on the other part of the body, the trunk, the hands, and the feet. The skin are usually thicker, so they can use a stronger topical steroid. And the duration wise also, if during the very acute inflamed stage, the topical steroid is necessary to reduce the inflammation, to reduce the rashes, to reduce the redness. So if at that point of time, the doctor might use a stronger topical steroid. Then once the lesions improve over time, doctor will adjust the topical steroid accordingly, right? From the strong one reduce to the mild one, and so on and so forth. Okay.
Okay, got it. So basically, topical steroids are safe and effective to use, but you
Yeah,
need to get the
the
right
proper
prescription from
guideline,
your doctor.
and proper
Right.
follow up
Yeah.
under the
Because
proper guidance with the
Yeah,
doctors.
because young Cheng Chok is saying, yes, I always worry steroids because I thought it is bad. And Dr. Google doesn't help either, right? Because you Google and you hear so
Then
many
you get
things,
so
right?
phobic, and then yeah,
Yeah,
from all the information, you don't know which one to trust, things like that. Yeah.
right. Okay, we sorted that out for you. Okay, so listen to Dr. T. Can we have the next slide, please? Okay,
Okay.
this
Just
is
now
wet
also
rat, right?
yeah, just now also there are some other topical
Uh-huh.
in which we didn't talk because if let's say the skin is infected, so
Mhm.
doctor will need to give a topical antibiotic to treat the infection. Topic
Mm.
which contain the antibiotic inside. And other currently we have some steroid-free type of topical in certain condition if necessary. Okay, so
Mm.
that go for topical. Then another therapy which is quite effective for mild to moderate atopic eczema is what we call wet wrap therapy. Okay, it sounds like a very strange word, right? So, but what does it mean by wet wrap therapy?
Sounds like a
Okay.
spa.
Okay, so it actually meaning we apply the wet dressing on our skin.
Mhm.
Wet dressing on our skin. It's basically come into it consists two layers. Inner layers is the wet layer, and then followed by the outer layer, which is the dry layer. So usually the doctors will instruct the patients to apply moisturizer. Okay, you must apply the moisturizer on the skin area, and then sometimes they will also add on the mild steroid cream. After applying the moisturizer, you apply the mild steroid cream. Then for the inner layer, the patient will soak a clothing. Usually is sometimes it's like come into garment form like even the clothing, or
Mhm.
sometimes tubular bandage or gauze, things like that. Yeah. So the fabric, the fabric. So the first layer they will soak with water, and then after that apply on the surface. Okay. So that is a wet layer, right? So
Mhm.
then after that, they followed by a second layer, which is the dry area. It's also the fabric, or we call the bandage, tubifast, then followed by the second layer. So actually, it contains two layers. Okay, so
Wow.
the patient will wear it and it can live on for a few hours depending on the severity, and some might even overnight. Okay, for the children.
Wow. Okay.
Okay, this is actually is why it is beneficial. For example,
Mhm.
like if the patient is having severe itchiness, so you have already wrapped the patient, so it will prevent the patient from scratching,
Scratching.
yeah?
Mm.
So and causing more problem. So it prevents,
Especially for children, right? Very,
yeah,
very useful.
so
Mm.
it prevents scratching, and because of the wet layer, it also increases absorption of the things that we apply, of the topical that we apply, because we apply the moisturizer, right, and then followed by a steroid cream. So it increases the absorption. So it increases the effectiveness of the treatment. So it
Okay.
reduces the inflammation further lah, and
Mhm.
improve the skin function better. So
Okay. Got it. Do we have another slide or is this just it? All right. So basically, this is the last slide. Yeah.
mm.
Okay.
So the other treatment is a phototherapy. Just now I mentioned, right? UV
Mhm.
light. So for more severe atopic eczema, other treatment is the UV light, or what we call phototherapy. This is a type of treatment in which in our setting is available in the government hospital, for example, Hospital Kuala Lumpur,
Mhm.
Hospital Jaya, mainly in government hospital Tengku Ampuan Rahimah. So in which they have a cabin, the what we call phototherapy cabin. And what the patient do is the patient will attend the hospital 2 to 3 times per week. Okay, so you go into the cabin and the light will shine on your skin area. Okay, shine on your body surface area maybe for a few minutes or few minutes. Then after that, you complete the treatment and then you go home. So this type of therapy is time consuming and you need to be compliant. Okay, you need to have the time to go to the hospital. But however, they are safe and they are effective. Okay, so the topical therapy and then followed by the wet wrap therapy. Then the other option is the UV light phototherapy, which is the next step to consider. But however, a lot of patients is facing difficulty to attend to the hospital regularly.
Leceh lah, huh?
Due to
Yeah.
the work, a lot of things lah.
Yeah.
Okay.
And then the oral therapy?
The oral therapy, for very severe cases, atopic eczema, not improving with all the cream, everything you have applied already under the sun. You have tried all the moisturizer already, all the brand not working. Okay, there are some medication, as I mentioned just now, the oral, what we call, or the oral immunosuppressive drugs. So, so these are the medications are strong, so it might affect the lower the patient's body immune systems, and they will be given if necessary and under proper guidance. The patient will need a follow up with a regular blood test, regular monitoring of symptoms, and because it also increases the risk of getting infections, things like that.
Okay.
Yeah, so these are the oral immunosuppressive drugs.
Okay. So last few questions before we go into the Q&A. Doc, what are some of the biggest mistake that most people make when it comes to eczema? And lastly, what 3 tips would you give to people or parents who have eczema or kids with eczema? What's the biggest mistake most people make with eczema when it comes to eczema?
I think the biggest mistake in the atopic eczema, okay, is a lot of people think that food allergy is the main and only cause for the eczema. And it's very, very important. So they try to avoid all the food and then hope that the eczema will cure. But as we went through just now, so the atopic eczema actually is due to plenty of factors, multifactorial. So actually the mainstay, the treatment is still centered on the good skin care and proper hydration of the skin. Rather than you try to control all the food and avoid all the food. That's one mistake that the perception that patient has. Another is of course, have to mention about the steroid phobia. Steroid actually is necessary in certain conditions to control the inflammation, and if it can be used safely under proper guidance. There's another misconception that patients might have.
Okay, thank you. I think that really was a useful bit of information. Lastly, what 3 tips would you give to people or parents with kids who have eczema?
Okay, for parents with kids with atopic eczema, okay, the treat
Or for
early.
themselves, yeah. Treat early.
Treat
Okay.
early is very important for patients and to prevent it from getting worsened. And thing is regular moisturizing of the skin to maintain the skin to stay hydrated, and it's very important. So regular and diligently moisturizer application according to the severity of the atopic eczema. But I think this is also time consuming and needs cooperation from the parents. And I think the support also very important in terms of education one. So the support from the family members, all these are important factors that can affect the patient's mindset, so that be more compliant with the treatment and improve the condition, right? And other tips is to try to avoid all the possible triggering factors, because the trigger factors can make the eczema flash, right? So try to avoid all those things.
Wow. Okay. Thank you. That's been so beneficial for me. What did you guys get out of today's session? Please let us know in the comment section. For me in particular, um, not to trust Dr. Google, I guess, because steroids is safe if not necessary, but you need to get the right prescription. There's also that belief that, food causes it. So those are my biggest takeaway. And lastly, the bit where you shared that the support is very important because there's mental stress as well that comes with eczema, right, Dr. T? Yeah.
Yes, of course, of course.
Mm.
This has proven that the impact in terms of the psychosocial aspect for
Mm-hmm.
eczema on patient is as heavy as diabetes.
Oh,
Okay,
wow.
the,
Okay.
the impact of diabetes on the patient is great, right?
Uh-huh.
So this disease, the effect on the patient's mental or psychosocial aspect is as great as the diabetes. So
Wow. Okay.
we shouldn't overlook this eczema problem, especially
Okay.
those who suffer from the very severe itch, severe dry skin, or very severe condition. Yeah.
Okay, got it. So there you have it, ladies and gentlemen. Is the impact of the stress is as big as if you have diabetes. So if you have kids with eczema, please pay close attention to it. Now let's go into the Q&A, right? We're doing the Q&A right now. So I'm gonna go into the questions. Let me just go up. Okay, so T. Chin Han is asking, my daughter loves to exercise. She will start scratching when she heats up while exercising. Is there any advice for this, Dr. T? What's your advice?
Yeah, okay, it's good to exercise. Yeah, yeah, but however, children with atopic eczema do find that they have an increase in terms of itchiness
Mm-hmm.
if the sweat stays on the body because of the physical irritation. Mm. And then but I really encourage exercise. So maybe after the exercise or during exercise, when the sweats come out, you try to clean it with the clean material and can resume the exercise again. Yeah, and after the exercise, you should go to bathing or what and remove the sweats from staying long hours on our skin. Yeah.
Right. Okay. Pretty good
You
advice.
know, if the habit is after exercise, then you wait for a few hours, you go here, go there, and then the sweats all stay on our body. And then after long hours, maybe after 10 hours, then only go for a shower is not that good because it not only increases the risk of worsening the eczema, it also increases the risk of getting other skin infections, for example, fungal skin infection, things like that.
Okay, got it. Jang Suki is asking, is it normal for a kid with parents of history of asthma and for the kid to develop eczema near the buttock and posterior thigh that, scratching all day and night until the skin break down? So can it be treated with steroid ointments?
Okay, so now the young kid with parent history asthma. So okay, so now there's a family history of the
Mhm.
atopic asthma, right? So maybe the child also having it's a atopic eczema. Yeah,
Mhm.
if it's very itchy, then they scratch, then the skin break down, become chronic, get infected. It can happen. Okay, and yeah, if the skin is inflamed at that point of time, yeah, it can be treated with a steroid topical with the proper guidance from the doctors. Yeah. Because
Okay.
the topical has properties of reducing the inflammation, reducing the itchiness, and improving the skin inflammation. Mm.
All right. So it can only be treated with steroid ointments, lah. Yeah.
Not to say can
Or
only, but have to be under proper guidance. Yeah. Mm.
right. Okay. So make sure you get proper guidance because.
Moisturizer plus
Mhm.
steroid. Moisturizer is
Okay.
still the main important thing. Yeah.
Okay, got it. Alicia is asking, what are solutions for eczema? We covered that. What can be used, what can't be used? Is there anything that people are doing that they're mistaking for eczema that they should avoid?
Oh, just now I think I went
Yeah.
through for all the possible triggering factors. Okay.
Uh-huh.
Can you
Solutions, but are there things that cannot be used?
solutions for eczema are the ways for the treatment. So what can
Uh-huh.
be used? All the topical, the things that we apply, moisturizer and
What cannot?
steroid, topical antibiotic in certain conditions. And
Mm-hmm.
why can't use?
Mm-hmm.
This one have to be what can't use, meaning the have to be careful with all the things that we use on our skin surface because the patients are at risk of getting worsening of the eczema, right? So when you use the detergents, the chemicals, everything have to be very cautious and try to avoid those very mild one compared to the harsh one. Mm,
Mm-hmm.
yeah.
Okay, got it. So basically, pay attention to the triggering points as well and eliminate as
Mm,
much as possible.
yes, yes, yes.
This question, I think we answered because she was controlling the food, but actually, it's not
Mm,
about the food. It's one of the biggest myths.
mm,
Yeah, Intan.
mhm.
So, MKS Dylan is asking, how do we resolve contact eczema? Because every time that part of leg touches the chair, clothes irritation starts. So this would be the infection type of eczema, is it?
No,
Oh,
this one is the avoidance of the contact. Then you will cure the
okay.
thing. Yeah, because the eczema is happen due to the contact. Yeah, the contact causing skin irritation. So
Mm.
remove the offenders. We have to remove the triggering factors. Then the skin condition can improve or even resolve. Yeah, for example, if the eczema arise from the irritation due to the new type of hair shampoo that you use. So once we remove that triggering factors, contact eczema has a higher chance of being cured, right? Yeah. So if let's say the contact eczema is due to contact with certain things, for example, contact with excessive sun exposure, then causing the photodermatitis. So if we avoid excessive sun exposure, the patient's eczema also can improve. Okay.
Okay, got it. So Intan Baizura's next question is that her son has both asthma and eczema on his scalp, a crease of his
Mhm.
nose and behind the ears. What would be a suitable cream for him to ease the redness and itchiness?
Okay, asthma. So this one, the patient himself has a personal history of atopy. So maybe he is also in at risk of atopic eczema. So scalp, crease of the nose and behind his ear. Okay. So the scalp, we have a special shampoo to treat in eczema. So with the active ingredient, but of course, again, have to depends on the condition. We have antifungal shampoo, things like that. But have to depends on the condition. And lesion just now, lesion can be on the nose and behind the ears. Okay, so in this case, yeah, maybe the patient will benefit from steroid, most likely, yeah, to reduce the itch, to reduce the inflammation, yeah, with the proper guidance. Yeah.
Right. Okay. So definitely got to bring him in just to make sure that everything, the prescription is correct. Yeah. So what we're going to do now, because of time check, we're going to go into quiz, and then while waiting for the results, I'll get back to your answers. Yeah. So hang in there. I'll get back to your questions. So hang in there. Now, let's go into the quiz. I believe we have some goodies up for grabs. Wow, there's some sound there. Where you guys stand a chance to win a set of Aveeno body wash and moisturizing lotion for dry, sensitive skin, plus a hospital bag. So, what do you guys need to do? Now, first, you have to be sure to share this video at least 3 times and remember to set the share post to public. to make sure everybody sees it. Number 2, you got to answer the 3 questions that we're going to show you on the screen and in a single comment, and you're on your way to win the prizes. Let me repeat that. First, you got to share this video out 3 times, and remember to set the post to public so everyone can see it. Number 2, answer the questions that we're going to show you on the screen and give your answer in a single comment, and we will select the first 3 winners based on speed, the accuracy or the correct answers, and based on you sharing the post at least 3 times. So are you guys ready? If you guys are ready, let's take a look at the questions. All right, the first question is, our skin has 3 layers. Just choose true or false. There are only 2 types of eczema. True or false? Atopic eczema is contagious. True or false? Let us know in the comment section. Answer them, and you stand a chance to win. Yeah. So our skin has 3 layers. True or false? There are only 2 types. There are only 2 types of eczema. True or false? And atopic eczema is contagious. True or false? Okay. Make sure you answer them. T, you got to answer them in a single line, okay? In a single comment. Then we can help you guys win. Remember the first 3 correct answers. MKS Dylan, very good. 1 line. So make sure you guys do that, and make sure you share the video. Yeah. So while waiting for our behind the scene crew to figure out who the winner is, well done, T. I'm gonna continue asking the questions. Yeah. So the last one was Intan's question. Dong Sit Yi, yeah, doctor, is asking, is swimming pool in a public pool or involvement in water activities like snorkeling causes eczema to be worse? Dr. T? I think we cannot hear Dr. T.
Hello.
Okay, yes, yeah, we can hear you now. Okay. Dr. T, there's a question from Dang So Yi. Is swimming in a public pool or involvement in water activities like snorkeling causes eczema to be worse?
Oh, okay. So swimming in the swimming pool, yeah, because of the chlorinated water, it has the risk of worsen the atopic eczema. But however, after swimming, you are encouraged, the patient with atopic eczema are encouraged to apply the moisturizer on the skin, because it might cause skin dryness.
Okay, yeah. Got it. So I guess we're
and apply moisturizer will help.
Okay.
Yeah.
Again, it goes back to the triggering factor. You want to know what it is so you can minimize the factors, kind of thing. Alicia is asking, how do you choose from lotion, cream, ointment, products, and soap?
Okay, so that depends on the condition of the skin. Okay, as I mentioned just now, the ointment is stronger than the cream, stronger than the lotion. So it depends on the severity of the dryness of the skin, and you are advisable to use the greasiest part that you can tolerate, that, and you are able to use it. Yes.
Okay, got it. But again, if it's for treatment, best to consult a doctor, right?
Yes.
Okay, and in terms of soap, is there any particular type we should get?
Soap will be very gentle soap. We prefer hypoallergen and perfume-free, those kind of soap. Okay, so it's gentle soap rather than the scented soap, things like that.
Chemical soap. Okay,
sometimes we use the moisturizer as a soap substitute, meaning we use the moisturizer, we apply on our skin, and then we take shower. We what we call soap substitute.
Yeah. Oh, I see. So that's possible. Okay, brilliant suggestion and tip there. There you go. Great question then. The last question is from Shahila Azwin. Can we use calamine lotion if we detect early or for babies?
Okay, calamine lotion. Okay, this one it still depends on the condition of the conditions of the babies, you know. So better get it checked first. I don't think it's proper to
put anything to the skin.
Yeah, put any comment without checking the babies, especially the babies, you know. So
okay.
We cannot generalize.
Okay. Shahida, please.
We need to assess. We see how.
Yeah.
Mm.
Shahila, if you can, please go and see a doctor because baby skin are very
Yeah.
sensitive.
Yeah, baby skins are very sensitive,
Okay.
really. Yeah.
Okay. And what about coconut oil? Gwen is asking with essential oil instead of lotion because coconut oil is supposed to be good,
With
right?
essential oil. Okay. Yeah, some of the patients do find that the coconut oil,
Yep.
or some they use virgin coconut oil or things like that. Yeah, it can act as a moisturizer, but really need to be very cautious in using, and because sometimes we are not sure the purity of the oil, or whether they have any additional other substances or chemicals or any other substances which can cause allergy to the skin. Yeah, so it
Mhm.
need to be very cautious. Yeah,
Okay. So you can do like a little
sometimes
patch
the
test, I
coconut
guess.
oil, can be used. Yeah, it's a
Okay.
moisturizer. Yes, it is
Okay.
a. Mm.
Okay, fantastic. All right, so that's it for now. And we actually have our winners, right? But before we announce the winners, let's take a look at what the right answers are. Okay, so first question, Doc, you're going to help me right now to answer. Well, there you go. The answer is so our skin
Okay.
has
Yeah.
3 layers. Doc, true or false?
True. So outermost layers is the epidermis, then followed by the dermis, and then the innermost is the subcutaneous fat. We contain
It's
the
so
fat.
it's so funny that I'm doing a test on the doctor. It should be on me, right?
Yeah,
If you think about it. Okay, and there are
it's
only two
okay.
types of eczema. Is that true or false, Doc?
No, definitely no. It's a myriad types. Okay, broadly divide into two categories, which is the
Ah,
internal. Yeah.
okay. So it's actually two categories of eczema. Got it. So Alan, like sneaky, okay? Sneaky question, yeah, trick question. Atopic eczema is contagious. True or false?
Okay, you cannot catch the atopic eczema via the contact with the patient with atopic eczema. No, it's not contagious unless it is infected, and then it's the risk is the infection will get contagious. Yeah.
Okay, got it. Congratulations. And our winner is MKS Dylan, T. Chi Harn, and Intan Baizura. Congratulations. Woohoo.
Ah,
Okay.
congratulations.
Okay,
Yeah.
so just sit tight, guys, because what we're gonna do is we will be messaging you guys, MKS Dylan, Tichi Harn, Intan Baizura, to get your details within a day. So hang in there. Make sure you check your DMs, your messenger, because we're gonna reach out to you and share with you how you can how we're gonna send the stuff over. Okay, sounds good. Thank you so much, guys, and thank you so much, Doc, for today. We definitely learned so much from you. Very, very insightful. Right, guys? Let us know. And I think let's give Dr. T a round of applause, shall we? To thank Dr. T. Thank you so much, Doc.
Thank you so much. Thank you, Nina. And thank you for the opportunity for me to share with all the people out there on the information. And I hope you will benefit from my session and further improve your skin condition if you have any problem. Okay. Thank
All right.
you.
Thanks. Bye. All right. That's all the time we have for today. Congratulations to our winners, MKS Dylan, Teaching Harn, Intan by Zura. But unfortunately, that's all the time we have today. We hope you learned a lot. And if you know someone who's going to appreciate this video and insights from today's video, please share this video out to them. Tag them because you never know who it's going to make a difference to. And give us a lot of like and lots of loves while you're at it. Okay. Thank you again. Till then, take care of yourself and each other, and we'll see you in the next episode. Bye.